Hello friends, I am Dr. Ajay Kumar. I am Chairman and Head of the Department of BLK Institute of Digestive and Liver Diseases in New Delhi. So when we talk about that the disease of a fatty liver, is it so common? It causes such a significant morbidity, both liver and outside the liver, then actually it's important to understand that how do we manage these patients. So most important, let's start from number one, that we must identify the associated conditions which contribute to fatty liver. And what are these? Though it may not be primarily alcohol-induced liver disease, but those fatty liver patients who consume alcohol are obviously more vulnerable to it. So first and foremost is to advise them to stop alcohol completely if they are consuming it. Then second part comes is the associated diseases, and two most important is the diabetes and hypertriglyceridemia and cholesterolemia. We must screen them, and if they are diabetic and dyslipidemic, adequate control of this is quite rewarding, and quite often it helps us in bringing down the fatty liver to normal. And the next thing which comes in the certain medicines, and you should look at the medicines which can cause, especially something like steroids, which can cause fatty liver, and that's what we should be avoiding in these group of patients. And last but not the least, actually this is the most cornerstone of treatment, the obesity is important part of that, and obesity has to be controlled. And we all know what are the various methods for that. That is exercise and diet control. In fact, diet is a major important, which we'll talk in more detail. Question is how much exercise? Exercise, even if your weight does not come down, exercise is known to reduce the liver fat. So just because somebody comes back and says, Doctor, I have been exercising but I am not losing weight, that does not mean he or she is harming herself or himself. It also helps in reducing the liver fat. How much of exercise? Well, it's about, more important is how speed. You should be doing 6 kilometers per hour. So about 3 to 4 kilometers a day and about 5 to 6 days a week is an important. So the both amount of the exercise and two, the speed of exercise. Of course, both aerobic and exercises as well as the pressure exercises are important for this. So any type of exercise is important, and that becomes the important cornerstone. In every visit of the patient, this needs to be re-stressed, and every time you need to be just not go by the patient's definition. Yes, doctor, I'm doing the exercise. You should specifically ask them what exercise, how much exercise, and one should be trying to guide them to force them or to insist on them to do more. So weight reduction, one is exercise, and second part is the diet. Now in diet, you need to cut down the calories. It should be a low calorie diet, that is 1200 to 1600 kilocalories per day. It should be low fat diet, that is the less than 10% of saturated fatty acids. It should be low carbohydrate diet, that the less than 50% of the total calories should be constituted by carbohydrates, and that's what is advised. People have talked about going for bariatric surgery in morbid obesity, both as a part of a treatment of NAFLD or also in a patients of a cirrhosis which is fat induced. While the evidence for the non-cirrhotic patients of a bariatric surgery is important, which is adequate, and this definitely helps. While in cirrhotics, it does help, but at the same time, there are reservations about that because it becomes a high risk surgery. There are more complications. There are no endoscopic methods available with the balloons and endoscopic suturing. All these are newer methods, relatively newer methods, and that is basically I'm talking about in reduction of weight, which will help us in taking care of fatty liver.